So I think what's interesting, and when we look back, I was just reading a piece on the initial case identification for the Equator Province Ebola case. So this was basically done by essentially a lab technologist that lived in the same village as this person that has come to infection. This is somebody who basically had access to infrastructure to be able to actually provide diagnostics. So I think what we can kind of take away from this is we actually have seen a very slow buildup of infrastructure in some of these regions, at least from the aspect of being able to provide faster identification, which is fantastic. I think that actually allows people to be a little bit more responsive as individual communities as compared to being completely reliant on the international communities. That being said, I still spend a lot of time in West Africa. Spend time in Central Africa. Things that we know that those regions are still lacking is just proper or normal healthcare infrastructure. So I think part of the reason that I think that we could kind of continually see these issues um, is we have a population that really is ill prepared to be able to deal with any type of strife that they see within the region. So I think if we can better prepare communities at the local level to be responsive without having to rely on the time delay of getting international agencies in, including with vaccination campaigns. I think that we're going to provide obviously a better opportunity for those communities to respond. But I think more importantly, we're going to probably build up trust, which is something that I think we're still lacking on at least the regions that I visit in. So I'm hopeful that we're moving in that direction. But we still need to put in a lot of time and a lot of effort to keep building those bridges.
So I think that's an important question. After spending a fair amount of time in various countries in Africa, I think one of the things that I've learned is that it's really important, as anyone who's going over to any other country, to really invest in building relationships and building collaborations. And so I think that whenever you work in another country, it's really important to um, be involved and be invested in capacity building. So they know that you're not just going in there for whatever reason. And I think some of the things that I've been involved in where there's been investment in teaching and training and really letting the in country national team or national group that you're working with learn from whatever you're coming in there to do, and then letting them take the lead. So, these types of programs that really invest in the ability where you can teach and train these people, and then they go on and teach and train other people in country. I think those are really important types of initiatives. So it empowers people from within these countries to take on leadership roles in and of themselves, because we do need to invest in building up healthcare capacities within all these countries. Case in point, Sierra Leone, Liberia, Guinea, these countries themselves were devastated by the 2014 Ebola outbreak, and many of their own physicians, nurses, first responders, they unfortunately succumbed to the disease. But one of the great opportunities we had during that outbreak was um, inspiring um, other people in their countries to potentially join the healthcare workforce. And I know that I worked with people in Sierra Leone who never thought about entering healthcare, but because they worked on the Ebola outbreak, became inspired to go to nursing school, go to medical school. And I think that it's important to support these types of individuals, and again, support these types of initiatives where we continue to foster education, teaching, and training from within the countries.
I mean, that sounds to me like what you're both saying is that there needs to be investment and enrichment, not just in terms of public health infrastructure as we typically think about it, but in terms of Congolese civil society as a whole.
Yeah, I absolutely agree with that, right? And I think part of what needs to be kind of mentioned as well with this is that it's also a two-way street, right? That many of the efforts that Dr. Kapali and I have undertaken in various regions in Africa, have not only been to provide training and expertise on the ground, or try to provide some auspice of empowerment for individuals, but also to take back understanding of the cultural norms, and also understandings of how things are done within those regions. So we look at things like contact tracing. We have obviously mechanisms to do contact tracing based on our own environments. But what are the things that in those regions that they've been able to do in the past for contact tracing that also provide community support and community trust? So I think we're really starting to see a shift in terms of the focus being not just we coming in and saying this is what you should do, but also saying what things can we learn from you that will better position us over the long term to remain collaborative and be more responsive and from partnership standpoint.
Many of these countries, DRC, Uganda, other countries in West Africa, so many countries, right? These are countries that have a lot of experience in dealing with infectious diseases outbreaks. And that is something that we really can learn a lot from. And these are countries that don't have an abundance of resources as well. And I do think that just looking more broadly and globally, this is a large reason why they have been able to be a little bit more successful and manage the coronavirus outbreak. They're used to responding to infectious diseases. They're used to doing the things that need to be done, like contact tracing and testing and dealing with limited resources. And those are things that I do think, as a society overall, are things that we can learn from. I think there are many things that we can learn from DRC and how they've managed the Ebola outbreaks that they've had to handle. They learned how to do a great job with community engagement. If they had not been
Mhm.
able to engage the community in Eastern DRC, we would not be at the point we are today. They Ebola is all about contact tracing. They've done a phenomenal job in contact tracing in the direst of circumstances where their frontline workers were constantly under threat of violence and death, and they've figured that out. And so I think it's really important for the global community that is currently now struggling with coronavirus to take these lessons from those who worked in DRC, the frontline workers, the Congolese, the WHO workers, and learn from them to see what lessons we can apply to our own response.